We're going to begin our second webinar in our 5-part series on sheep and goat health. Tonight we're going to talk about preventative health management. The following webinars will be held the next 3 consecutive Thursdays. I was thinking we might be going one more week. I was thinking we might not be able to pull the one off this evening, but fortunately had another option. So again, just to remind you of a couple of things, if you miss a webinar, you can watch the recording. All the webinars will be recorded, so long as I remember. I need to do a little bit of editing on them, mostly taking out the beginning and the end, and then I need to click a button and make them public for viewing, and then let you know what that link is. All of those links are available on that web page that you see bolded at the bottom of the slide. sheepandgoat.com/recordings.html. There are links to the recordings and there are links to the PowerPoint presentations. Tonight's PowerPoint presentation has already been uploaded. I did edit last week's webinar and there is a link to that up there as well. And this evening's it will be the same. You can also view previous webinars. The webinars go back to 2011 and cover a variety of topics. Some people were having a little problem with the foot health webinars that are on that page as well. Those webinars are actually in the University of Maine system, and I know that when I tried to access them today, when my internet worked all the way up to about 5:30. I didn't have any trouble accessing those University of Maine webinars. But otherwise we're looking into that for the person or persons who had difficulty. As far as I know, all the University of Maryland webinar links are accurate and the webinars work fine for viewing. Just a reminder of who the instructions for the webinars are. Myself, Sheep and Goat Specialist at the University of Maryland, Western Maryland Research and Education Center. Jeff Semler, who's the county extension agent in this county, is also an instructor. Of course, as I indicated tonight, he's not going to be able to join us in the chat box unless he miraculously gets internet. But it's amazing how many devices you can have in your house and not be able to connect to the internet. And the mobile devices won't work with the standard software. Some of you may have tried. I think you have to buy special Adobe Connect mobile software in order to be able to access the webinars from tablets or smartphones, so that didn't work. So like I said, we're both having difficulty tonight. We both have the same provider. Sometimes these things just happen. So again, I'd ask that you can chat to each other, but primarily try to save the questions for the end. I may glance over there if I can, but it'd probably be best if we just save questions for the end. So tonight's presentation is about preventative health management, and basically what I wanted to talk about tonight is vaccinations, parasite control, hoof care. Those are the 3 main topics, and a little bit about nutrition, because you really can't talk about health and not talk about nutrition because they're so intertwined. So my first topic is vaccinations. Basically, we vaccinate animals and people both to prevent and control diseases. In some cases we're vaccinating because we don't want to get the disease. In other cases we're vaccinating because we want to reduce the severity or the frequency or the prevalence of the disease. And of course it's always important to understand that no vaccine is 100% effective. Sometimes the disease challenge can be just so great. So, should you vaccinate? Why should you vaccinate? Why might you not vaccinate? Well, again, you vaccinate to manage disease risk, to prevent and control diseases. And you would choose to vaccinate for particular diseases because you perceive the disease risk to be high. And that's going to vary by farm, even by location. There's some diseases that we don't have in Maryland that they have in other states or in other countries. The way you raise animals or purchase animals can affect what diseases you're at a high risk for. Essentially, vaccinating is like buying insurance. You're spending a little bit of money in hopes that you don't have a big disease outbreak. Obviously, you want it to be cost effective, and keep in mind there's several costs to vaccination. Usually the cost of the vaccine, in my opinion, is the least of the costs. The labor, the time that it takes to give that vaccine, and then a lot of vaccines cause tissue reactions at the injection site, and I consider that to be a cost as well. And of course, another reason to vaccinate is simply to increase the value of your animals. I'm going to think more of a farm that vaccinates for certain diseases than one that doesn't. If they don't do it, I'm going to have to do it. So maybe these animals are worth just a little bit more to me. I can think of just as many reasons why not to vaccinate. Now, I don't mean vaccinate in general. I mean vaccinate for specific diseases, because I do think there's some vaccinations that all sheep and goat farms should do. And the reason I might not vaccinate for a disease is because the risk of that of my animals getting that disease is low, that it's not cost effective. I also might not vaccinate because that vaccine has not been proven to be effective, and I can give you some examples of that. I might not vaccinate because there is no approved vaccine. You know, there are things that we might like to vaccinate for. We'd all like to vaccinate for the barber pole worm, and they are working on a vaccine for the barber pole worm, but it's not yet available, or it may never be available, but we would all like to if it was available. Whereas in other cases, there simply isn't an approved vaccine. And this is particularly true with goats. We have vaccines that are approved for sheep that aren't approved for goats. Sometimes it's okay to use them for goats, and sometimes we shouldn't use them for goats, and we'll talk about some of that. I wouldn't vaccinate if it's going to introduce a disease to my farm. And there are certain diseases that you shouldn't vaccinate for unless you already have them. And that sounds kind of crazy, but like I said, vaccines in some cases prevent diseases, and in other cases they reduce the severity. That's the whole rationale behind a vaccine for the barber pole worm. We're not going to we're not going to eliminate the barber pole worm, but we're going to try to reduce its effects. Okay, so there are vaccines that will introduce a disease to that farm, and we'll talk about a couple of them. The other reason, and to me is a really big reason that we often don't think about, and that's that you're not going to do it right. Just because you buy a vaccine and you inject it into your animals doesn't mean you're doing it in a way that's going to be effective. Perfect example is Clostridial vaccinations, overeating disease and tetanus. If you only do it once, to lambs and kids, don't bother. You need to do it twice. If you're not going to be clean about it and sanitary about it, if you're not going to follow the directions on the label, then you shouldn't do it. If you're not going to, if you're not going to do it right, and sometimes you're not going to do it right you don't set out to do it on purpose. Sometimes just circumstances make it difficult. So think about some of those things, whether you can vaccinate for this disease or not, based on some of these factors. So there's a lot of different diseases that you can vaccinate sheep and goats for, and this probably isn't even a complete list. I can think of one other disease that you can vaccinate for in this country, and that would be blue tongue. And in other countries, there would be additional vaccines, either because they have additional diseases or they have the availability of different vaccines that we may not have. So we're going to go through, we're going to go through each of these and talk about how you would do it, why you would do it, and maybe how you would do it, and hopefully give you thought about each of these diseases and whether or not it makes sense to vaccinate on your farm. It's generally recommended that everybody, or all sheep and goat producers, vaccinate their animals for Clostridial diseases. These are bacteria that pretty much just live in the environment. If you remember last week when I talked about diseases that are endemic versus those that are introduced, these are things that are always in our environment, or in the soil, the manure, or the gut of the animal. And there's quite a few Clostridial diseases, and they're kind of broken into different groups depending on how they affect the body. And there are several that we routinely vaccinate sheep and goats for, and some that are pretty rare, and some that are more common in some geographic locations than others. But this is just kind of a whole list of them, with the scientific name on the left side and kind of the common name on the right side. Many of them I'm sure you're very familiar with. Tetanus, everybody's heard of botulism, gas gangrene, overeating disease, things like that. Well, for sheep and goats, there's basically 2 vaccines that are commonly used that vaccinate for different or various Clostridial diseases. The first one is a 3-way vaccine that we commonly just refer to as C, D, and T, because the C is for Clostridium perfringens type C, the D is for Clostridium perfringens type D, and the T is for tetanus. The C and D are what we call kind of the overeating diseases, with D being the classic overeating disease. The 2 of them also provide protection against type B enterotoxemia. So this is the common vaccine that most sheep and goat producers use, and that I would recommend that all sheep and goat producers vaccinate for. The other vaccine is an 8-way, and there's a 7-way out there too. The trade name is Covexin 8. It provides protection for the same Clostridial diseases that the 3-way does, type C, type D, and also type B, even though we don't have it written up there, but also tetanus. But then it also adds some other ones, black leg, red water, diseases that can afflict sheep and goats but don't tend to be that common. I would say for most people the 3-way vaccine is adequate, and I personally don't think you're being a better manager by giving the 8-way. Nothing wrong with giving the 8-way, but you probably don't need to. Whether there's a cost difference or anything otherwise, I really don't know, but the 3-way is in most situations going to be all that's necessary. This is a pretty busy slide. It's different groups of animals and how we should vaccinate for the Clostridial diseases, whether it's the 8-way or the 3-way. So on the left side are the mature animals, on the right side are the lambs and kids. So a first-time mom, a ewe or doe that's never lambed or kidded before, she should get 2 vaccinations with the CDT toxoid 3 and 6 weeks prior to parturition. Just the first time. Then she'll need an annual booster. The matured ewes and does should be vaccinated 1 month prior to parturition. The rationale for vaccinating the pregnant mom is so that she'll pass immunity to the lambs and kids through the colostrum. That immunity will last so long. In addition, we don't want to forget the mature or yearling males on the farm, the rams, the bucks, and the wethers, and they should be given an annual booster with the CD and T toxoid. So that's the mature animals, basically during the last month of pregnancy. If you don't vaccinate during the last month of pregnancy, you're really not going to get any protection for type C, because that affects young animals. Type B, you'll be fine for type D, and you'll also really need to do something extra for tetanus, and we'll talk about that. Now for the lambs and the kids. If mom was vaccinated, and assuming that lamb and kid consumed enough colostrum, there may be a few that don't fit into that. Maybe some orphans, or maybe the 4th one on a set of quads. But for the ones that got adequate colostrum, you can start to vaccinate them at about 8 to 12 weeks of age. That immunity is going to start to decline around 6 weeks of age. Now, none of these are exact numbers, you know. It doesn't have to be precisely at 8 weeks or 3 weeks or whatever. The key thing on the mature females is that you be at least 2 weeks before parturition. And then on the lambs and kids, for the most part, you want to make sure that you start that vaccination program before weaning, because the highest risk in terms of the lambs and kids at this age is going to be type D, that kind of the classic overeating disease. So you're going to begin at 8 to 10 weeks of age, and you're going to repeat that vaccination in 3 to 4 weeks. Most vaccinations require more than 1 dose to be effective. You'll get some immunity with 1 dose, but you really want to make sure you give that 2nd dose. If the lamb and kid was born to a mother that wasn't vaccinated, Or again, let's think about those orphans that maybe just didn't get enough colostrum, or you gave them a colostrum substitute or supplement, that they didn't get colostrum from a vaccinated mother. You can start to vaccinate them at 3 to 4 weeks of age. If you do it right at birth, there was a study done at Cornell a number of years ago that showed that that is going to have no effect. They really don't have a mature enough immune system at that age for that vaccination to be effective. So probably about 3 to 4 weeks of age would be as soon as I would give that vaccine. Again, you would repeat that in 3 to 4 weeks. 2 vaccinations. When in doubt, give 3. If you buy lambs or kids, either for your children to show at the fair, or you're going to feed them or graze them and resell them, and you don't know if they've been vaccinated twice, I would vaccinate them twice, 3 to 4 weeks apart. Again, the key one here is type D overeating disease. Each of the 3 main clostridial diseases have certain risk periods. C is that kind of that first month, the very young lamb or kid. D tends to be when they start eating more feed. If they're creep fed, it can happen earlier, but it tends to be, say, over a month of age. And tetanus, while tetanus can be a risk at any time, there's a deep penetrating wound. The highest risk period is usually when we're docking, castrating, and disbudding these young animals, particularly when we're using elastrator bands. That's when tetanus is at the greatest risk. And it's why it's so important that the mom be done, again, for tetanus and for type C. And type D, you can probably get by a little bit better on vaccinating just the lambs and the kids. So depending on their age and immune status, we have a little bit different protocol for vaccinating. Now, special considerations for tetanus. It's recommended that lambs and kids have immunity to tetanus when we dock, castrate, or disbud, especially if elastrator bands are used. And the reason elastrator bands are a risk is because they create an anaerobic place kind of where that band is on the tail or on the testicles, and that's the type of environment that the tetanus organism likes. These procedures should all be done when lambs and kids are young, less than 2 weeks of age. So if the dam was vaccinated for tetanus during that last month of pregnancy, at least 2 weeks out, using either the 3 or the 8-way, those offspring are going to have immunity to tetanus if they consumed enough colostrum. If you ever wonder what enough colostrum is, it's about 10% of live weight. If the lambs and kids are nursing their dams, of course we have a hard way of determining that, but if we're feeding orphans or hand feeding anything, again, it's about 10% of their live weight. So if they consumed like a colostrum substitute or colostrum from a dairy cow or something like that, they're not going to have that immunity for those vaccinations. So if you didn't vaccinate the mom, and you dock, castrate, or disbud within that first 2 weeks, which again is the period of time that you should do it, you need to give the tetanus antitoxin in order to have protection from tetanus. A lot of people wonder, how much you should give. You can see on the bottle it's 1,500. They do it in international units, is what they have written on the bottle, and you give different amounts of tetanus antitoxin based on prevention versus treatment and on different different sizes of the animal. The general recommendation is to give about 300 international units at the time that these procedures are done. What the antitoxin does is it provides immediate short-term protection. Probably lasts 7 to 14 days. So that's going to primarily get them over that risk period for those procedures. But it's not going to give them long-term immunity, because the toxoid products, the other products we were talking about in the previous slides, they will give longer-term immunity. It's just that they take time to develop immunity, and in order to get complete immunity, they take that second shot. So it's a much longer period of time. So if all you gave was toxoid at the time of docking and castrating, you would not be providing any protection for tetanus. But at the time that you give the antitoxin, you can give the toxoid at the same time. If you were doing it at like 4 weeks of age, you could give them at the same time. You don't mix them into a cocktail, but you could keep them in. You could do it at the same time. I see a couple of things being discussed about vaccines. Most vaccines require refrigeration, and even when you transport them, you buy them and you travel a half hour, you should make sure that you're storing them properly. Same thing when you push yourself through the mail. Make sure that they, and you buy them in the middle of summer. Make sure that they're kept cool. There's a lot of things about handling vaccines that's going to determine their effectiveness. So how you store them, making sure you don't buy expired vaccine, making sure you only use a clean needle to withdraw vaccine. If it's a vaccine that you had to reconstitute, you would discard that after you've used it for the day. Otherwise, you usually can store them for a certain period of time. So these next couple of slides, I'm going to talk about some optional vaccinations. I would recommend everybody vaccinate for the Clostridial diseases, but the rest of these diseases is going to be on an as-need basis, and it's going to be based on your situation and your perceived risk. So we'll go through a few of these, not necessarily in this order. The first one is sore mouth. Sore mouth is an example of a vaccine that you do not want to give unless you already have the disease or the virus on your farm. Sore mouth is a skin disease. It's caused by a virus in the pox family. It is very common in the sheep and goat industry. So if you already have it on your farm and you want to have some control in terms of when outbreaks may occur, or even if you don't have it but you think you're at high risk for sore mouth, for example, you show, then you may consider vaccinating for sore mouth. The thing to keep in mind about sore mouth is it is a live vaccine. You apply it topically to a part on the animal that you scratch or scarify. That area doesn't have any hair or wool on it. It's kind of an and it's not typically. They get sore mouth on the mouth, the nose, and the extremities, which makes it easy to transmit. The whole idea of vaccinating for sore mouth is to give it in a place that you choose at a time that you choose. The common places that we give it is inside the flank, like setting a lamb on his rump and then scarifying the inside flank. It's common to give the vaccine there. You can give it on the inside of the ear. You can give it under the tail, as you see in this picture here. In our buck test, we're in our 9th year, and we didn't have sore mouth the very first year, but we started getting it every year. And so we started vaccinating so that all of the bucks would basically be on an equal footing for the test. Some bucks had already come in vaccinated, and then others that were naive would be at a big disadvantage, so we started vaccinating them. We do it under the tail head, which quite honestly isn't ideal, because if you think of young males, often they put their faces under another buck's tail, and so getting it on where we don't want it, the face and the lips and the nostrils, we sometimes do get it. Because it's a live vaccine, you'll notice this young man is wearing gloves. You want to make sure that you do that. It is contagious to people. It's a zoonotic disease. It's called orth when people get it. A lot of people that raise, especially sheep, I think have had it. A lot of veterinarians have had it. I imagine it could be potentially painful. We also had a young man in our 4-H program that ended up getting Mercer's as a result of a sore mouth infection. The doctors didn't know what he had, but anyhow, he ended up having a worse situation. The vaccinations protocols vary in terms of what age and what time you give it. Obviously, if you're concerned about lambing and kidding, you're going to give it well in advance of lambing and kidding. It's going to take 2 to 4 weeks for that disease to progress, and it's going to progress the same from a natural infection versus a vaccination. You'll see blisters, and eventually, as it as it goes through its cycle, you'll eventually have scabs that'll fall off, and that's going to take 2 to 4 weeks. So you're going to want to be well in advance of lambing and kidding. So you would do the adults. Tiny bit of some passive immunity to the lambs, but not much. Often the new lamb or kid crop is done. You don't want to do it until they're at least a week of age, but it's common to do them. If you're worried about getting sore mouth at a show, which is probably one of the big risks of having sore mouth, is having it at the fair, or having it before the fair, because it is a disease that you will not be able to go to the fair, stay to the fair. You want to be at least 6 weeks before the fair. So again, there's some different protocols. And sore mouth vaccine is interesting in the sense that, you know, there's some evidence that giving animals the vaccine who have sore mouth, it'll speed up the process. An animal that has sore mouth has some immunity, which means he may, you know, the next time he's exposed, he may not get it, or it may not be as bad. There are different strains of sore mouth, so it's not just real, you know, simple cut and dry. But it can be a significant problem at the time of lambing and kidding, because sometimes that sore mouth can lead to getting lesions on the udder and have some mastitis problems and things like that. For the most part, it runs its course, but occasionally an animal, particularly a young one, sometimes that sore mouth infection can really knock them back. If there's enough lesions on their face, it can really reduce their nursing or their eating. It can lead to some secondary infections. There's no real cure for it. Some people think they speed the disease up with certain things, like WD-40 oil is one thing that people think may have an effect on the lesions, iodine. But when we've had it at the buck test, we just simply let it run its course. If we get an animal that's bad enough in terms of it affects his grazing and his overall health, then we'll pen him and take care of him. There's a 21-day slaughter withdrawal on the sore mouth vaccine. In fact, a lot of vaccines, most vaccines, the slaughter withdrawal is 21 days. Same thing for CD&T, so a 3-week withdrawal period. There are vaccines I don't indicate on this slide, but I believe, definitely for sheep, but I believe for both sheep and goats there are sore mouth vaccines. Another thing you can vaccinate for is caseous lymphadenitis. I think I got it spelled right. CL, it's easier to say CL. The whole point of vaccinating is not to prevent the disease, because you would not use it in a naive flock. The purpose of vaccinating for CL is to reduce the incidence and severity of the disease. So it would be used in a flock or herd where CL is pretty prevalent, and probably in a herd or flock where they aren't doing a lot of strong culling. So you want to do it if you have it, if you have a confirmed history of CL. Just because you have an abscess or two in your flock does not mean you have CL. I think I mentioned in the last class, if you have an abscess, you should test it and see what the cause is. Not all of them are CL. You don't want to vaccinate a naive flock or herd, particularly if you'd like to eradicate the disease, because these vaccinated animals are going to test positive in the blood. There's a high incidence of injection site lesions or abscesses with the CL vaccine. And of course that, I think I noticed in the chat box somebody mentioned that with the Covexin 8 that there were a lot of abscesses. I know certain years I've had considerable abscesses using a CDT vaccine. So that is to me one of the costs of vaccinations is the lesions that they can cause. So there's a fairly high incidence with the CL vaccine. They do have an individual vaccine, or I believe it's in combination, I think, with Clostridial perfringens type D. Has a 60-day slaughter withdrawal, so quite a bit longer withdrawal period than some of the other vaccines. The vaccine is not approved for goats, nor is it recommended for goats. The safety and efficacy of the vaccine in goats is unacceptable. So if you want to vaccinate for CL, you would want to make your own vaccine. That's what I mean by the one at the bottom is you can make your own vaccine or have vaccines made. But generally speaking, people have used the CL vaccine in goats, but it is not recommended. They have, in fact, in a lot of cases, goats have worse injection site lesions or abscesses even than sheep, and then some vaccines already cause a lot of lesions, and then you get a lot more with goats. So like I said, even though people have used the CL vaccine in goats, it is not recommended. And we'll talk about in the last class, the disease management, really the way that you ought to be dealing with CL in terms of control or eradication. You know, there are probably better ways than vaccination, but it is an option. Vaccinating for abortion. The three most common cause of abortions are chlamydia, which also is called enzootic abortion of ewes, which they use the acronym EAE. Can still happen to goats, but that's what they call it. Campylobacter, which we used to call vibriosis, or Vibrio was the common name. And then toxoplasmosis, which, if you recall, that's the one that cats are implicated, because toxoplasmosis is basically the coccidia that cats get. So those are the three most common causes of abortion. So, should you vaccinate for them? You can't vaccinate for all three of them, but should you vaccinate for abortion? If these infectious causes of abortions have been confirmed in your flock by a diagnostic laboratory, or they're highly suspected, you've been working with a veterinarian or a diagnostic lab, and they're highly suspected, you may vaccinate. If you're concerned about the health of the replacements that you purchase, you don't know and you'd feel better, or it's highly suspect, then you can vaccinate the replacements. You can vaccinate for chlamydia. You vaccinate 60 and 30 days prior to breeding that first time. So say those yearlings or lambs that you bought, and then you would booster that annually. For Vibrio, you would vaccinate 30 days prior to breeding, and then 60 to 90 days later. So somewhat similar, but a little more spread out. You would revaccinate annually. Okay, so that just like the CD&T vaccine, just like any vaccine, the first time you vaccinate twice, and then an annual booster. There is no vaccine in the United States for toxoplasmosis. I believe there is in Europe, but there is not in the United States. And neither vaccine is approved for goats. Whether there's been any studies or recommendations in terms of its extra label use, I'm not aware of anything, and this is something I would want to discuss with a veterinarian, or discuss even with the vaccine company. I wouldn't jump right in and use it for goats. I'd want to have a little more information, but I wasn't able to find any studies as far as or recommendations as far as using the vaccine in goats. And I would assume that the causes of abortion in ewes and does would be very similar. I apologize for that phone, but there's unfortunately nothing I can do about it because I'm at my dad's place. I can only hope that they pick it up soon. You know what I just did? I picked it up and hung it up. Okay, the next disease I want to talk about is rabies. Not something that we think about in terms of being a production risk on most sheep and goat farms. But I think there are definitely situations where we should consider vaccinating. Vaccinate if it's required. I think there are some shows, fairs, states that may require vaccination. Personally, I expect it to be a requirement everywhere eventually. In our buck test, they want to require it, but they haven't yet. But it's possible they may require it at some point in the future. If you think the risk is high, and I've given some examples of where I think the risk would be high, or if you have situations where animals have frequent contact with the public. So, fairs, festivals, and shows, those animals obviously come in contact with the public, may be required to be vaccinated. If you have a situation where you have a petting farm or an agritourism situation on your farm, I would definitely vaccinate. If you're going to lease your animals out for vegetation control in public areas, which a lot of them are, I would vaccinate. The goats that grazed the Congressional Cemetery this past summer, they were required to have a rabies vaccination. If you look at your own production situation, if you think your animals have a lot of potential exposure to wildlife and stray dogs and cats that might be infected with rabies, you might consider it. If there's a high prevalence of rabies in the area, you might consider it. High-value animals or pets. If you consume raw milk from your sheep or goats. These are all reasons that you might consider vaccinating for rabies. Only a veterinarian can give the vaccination, just like dogs and cats. There is a vaccine. It's a killed vaccine that's licensed for sheep, but it's not licensed for goats, but I presume it's what is given to goats extra label without any problem. And of course, just as a reminder, you should make sure all the cats and dogs on your premises are vaccinated. In Maryland, it's a law that they be vaccinated, and I'm going to assume that in most cases your states would require that dogs and cats be vaccinated as well. The gentleman that I buy hay for is a dairy farmer, and one of his cows got rabies, and then he was exposed to rabies and had to go through those very painful rabies shots. So it kind of puts some of that risk in perspective. Maybe the risk isn't high for rabies, but it certainly does exist, and it may not be worth taking, particularly if you have a small number of animals, or like I said, valuable animals. The last couple of things, just to briefly mention that you can vaccinate sheep for. First one is foot rot. Again, the purpose is not to prevent foot rot, but it's to reduce the incidence of foot rot. The injection site abscess is very common with the foot rot vaccine. But as far as I know right now, the vaccine is called FootVax, or that's the one that was on the market. I'm not aware that it's on the market right now. I don't think it's readily available. I think we actually have found that there are some better ways to control and eradicate foot rot than the vaccine. It is an option, but like I said, I'm not sure it's available right now. Epididymitis is a disease caused by Brucella ovis. It causes the swelling of the epididymis. There's a vaccine for it, but it's generally recommended that it not be used, because if you vaccinated your rams for it, you'd never be able to sell rams. It's kind of like CL. Probably the better strategy is to test and cull than to use the vaccine. You can vaccinate for pneumonia. There is a vaccine for pneumonia caused by Pasteurella. You give 2 shots, 2 to 4 weeks apart. You can vaccinate the dams during late pregnancy with the hopes of getting some passive immunity. You can vaccinate the lambs and the kids, and it is approved for sheep, goats, and cattle. Wasn't really able to find much work done with the vaccine. There was a study done at the University of Wisconsin several years ago. They tested both this vaccine and the intranasal vaccine that Cornell looked at. They didn't have a high enough death rate or incidence of pneumonia to notice any differences, so they didn't really say whether they weren't able to recommend or not recommend the vaccine. But it is pretty readily used, pretty well used worldwide. And like I said, it affects the pneumonia caused by Pasteurella. Some people have used cattle pneumonia vaccines, and you got to be careful using things that are for cattle, because there can be significant differences in them. For example, the cattle vaccine for pink eye, I don't think is even the same organism or strain that causes pink eye in sheep and goats. But people have, in particular, have used the para-influenza, which is the PI3 vaccine, and Cornell did a study a couple years ago, and they didn't see any influence of using that vaccine on the incidences of pneumonia in lambs. And I noticed somebody asked a question about the Pasteurella vaccine. Yeah, you'd need to repeat that. It would need to be repeated annually before lambing and kidding, and to the kids and lambs if you wanted to have that protection. So those are the additional vaccines that you could use. The only other vaccine I can think of for sheep and goats in the United States, there is a blue tongue vaccine, and that would be very geographically oriented. Pretty much epididymitis is too. That tends to be more of a Western problem, whereas things like pneumonia, foot rot, CL, all of those things are pretty universal. But there are a few geographic limitations on diseases. Okay, now we're going to move to my next topic, my favorite topic, in fact, and that's internal parasite control. Internal parasites are the major health problem affecting sheep and goats. And obviously it does depend on your geography. If you're in West Texas, they're not so much of a problem. But in most areas where either you get some humidity in a warm climate, or at least you get a portion of your summer that you get rain and you get some humidity and some moisture and some warmth, then you're going to have some parasite problems. Okay, and there's two parasites that are of primary concern. Sheep and goats can be affected by a lot of different parasites, but these are by far the two biggest ones. Comonchus contortus, which is the barber pole worm. You see in that picture that lamb or goat, probably a goat, is pretty anemic, definitely very heavily infested with the barber pole worm. And then Coccidia, and that looks like a typical animal that's suffering from coccidiosis. So these are our two primary parasites. So how do we control them? And there's two ways to control parasites, whether we're talking stomach worms or coccidia. First one is management, second one is drugs. We want management to be our first choice, and we want it to minimize the use of our second choice, which is the drugs, or any other type of therapy. So I could spend a long time on this slide right here talking about the different ways that we can use management to control exposure to parasites. The first obviously is pasture, rest, and rotation, what we typically call rotational grazing. Both rest and rotation affect the parasite challenge. The longer a pasture's rested, the longer time that eggs die and larvae die, and the cleaner that pasture gets. The quicker the animals rotate, the less feces, the less eggs, and less larvae. So both of them are important. And there's not necessarily magical numbers. If I could say anything, the key is how quickly do they come back to the pasture? How long is it rested? Probably takes a couple of months to have a almost clean pasture. Probably takes 6 months to a year to have a completely clean pasture. How about a clean pasture? What is a clean pasture? Clean pasture would be one that has no infection. And there's a lot of different ways to get a clean pasture, and it's not easy or possible even for every farm. One example is what you see here in the picture, and that's to plant annual forages. Anytime you replant, disturb the sod, you're essentially creating a clean pasture. Even cutting a hay crop, where you're cutting the hay you're cutting that down very low and exposing the eggs and the larvae to the sun. All those are creating clean pastures. This is a picture of our buck test. It's a paddock of forage sorghum, so it was planted in at the beginning of June and provided grazing about 6 weeks later. It was a clean pasture. There was no worm infection in there. So the use of annuals, the use of taking a hay crop off, maybe a neighbor lets you graze their hay fields or something one time a year, or their pumpkin patch one time a year. Those kind of things can be clean pastures. For most of us, just to set a pasture aside for a year or 6 months is pretty tough. Nutritional, and I've got in parentheses protein supplementation. That has an effect on the animal's ability to tolerate parasites. The barber pole worm sucks blood, which has protein in it. So protein supplementation can help. There was a recent study done at West Virginia University where they looked at different kinds of protein, and they think that lumen bypass protein may be advantageous than, say, your run-of-the-mill protein. But nutritional supplementation, when pasture quality and quantity isn't like it should be, but in particular protein supplementation, particularly with the young animals. The season of lambing and kidding. If you lamb early, say now, or you lamb in the fall, you're probably going to have less parasite problems than if you lamb in the spring. I'm not saying you shouldn't lamb or kid in the spring, but parasites are going to be a bigger challenge. So you can lamb and kid at different times of the year to lessen that challenge. Browsing goats, or simply grazing taller forages like you see here in the picture. A goat that browses, is up on his hind legs, has his head up, is eating off the top of a 2-foot tall piece of grass is not going to get infected. The parasites live close to the ground where the moisture is in the first 2 2 or 3 inches. That's what the majority they are. So anything we can do to manage that grazing height. Don't let animals graze below 2 or 3 inches. That's where all the worm larva is. It's one of the reasons we have problems with goats, in the sense that they're a browser. They don't really want to graze low. In many cases we force them to graze low, and we have problems with them. Sheep naturally want to graze low, but we still can control that grazing height. Multi-species grazing, sheep and goats share the same parasites. Cattle do not. Horses do not. So whether it's sequential grazing, a leader-follower system, grazing them at the same time, alternating pastures, there's different ways to utilize other species to help manage the parasite problem. High tannin forages. Tannins have been shown to reduce problems with parasites. The tall forages are also not a problem with, I don't believe, a problem with the meningeal worm. They're gonna pick up those snails in wet, low-lying areas, not high on forage. Genetic selection is another way to control parasites. Obviously, it's a long-term kind of management decision. We can choose breeds that are more resistant to parasites, and we can choose individuals within our flock or herd that are more resistant to parasites. It's a really good article that is on the website of the American Consortium for Small Ruminant Parasite Control about how some sheep producers are using genetic selection to reduce parasite problems. Parasite infection, which we measure with fecal egg counts, is a moderately heritable trait, meaning we can make progress. So genetic selection is another way. No matter how good a manager we are, more than likely we're going to have some animals that are going to need to be treated with drugs. Dewormers, anthelmintics, whatever you want to call them. And what we want to teach or encourage producers to do is to use a couple of decision-making tools to determine which animals need dewormed and when, and not to collectively deworm the whole flock or herd or the entire group. And we're going to talk about the FAMACHA system and the 5-point check to determine which animals need treated. A couple of other things when we're using the drugs or dewormers, we want to make sure we dose according to an accurate weight. You really need a method to weigh goats and sheep. You always need to use oral drench products. You need to deposit that drench over the tongue into the esophagus using a syringe that has a long metal nozzle. You need to understand that goats need higher doses of drugs than sheep. They metabolize them quicker, they clear their system quicker. They usually need 1.5 to 2 times the sheep dose, 1.5 being for levamisole or prohibit, and 2 times for all the other drugs. Ultimately, it doesn't do you any good at all to use these dewormers if you don't know if they're effective. And so we need to test for anthelmintic resistance either by using fecal egg counts or by submitting a fecal sample for what we call the drench right test. And we're going to talk about these tests next week when we talk about diagnosing and treating diseases. We'll talk specifically about a lot of the different tests that we can do regarding internal parasites. The FAMACHA system is one decision-making tool. Anemia, paleness in the mucous membranes is the primary symptom of barber pole worm infection. In reality, the diagnostic test for the barber pole worm would actually be a blood test, packed cell volume, blood hematocrit. What the FAMACHA card does is it estimates the level of anemia, it estimates packed cell volume. And then on that card, each of those scores gives a treatment recommendation. 1 and 2, which are the higher packed cell volumes, are not showing signs of anemia, so the recommendation is no treatment. 4 and 5, which is a pale pink and a white, colors aren't quite right in this slide, showing high levels of anemia. In fact, those animals may well die if they don't get an effective treatment. So there's a treatment recommendation to do them. 3, treatment score 3, some anemia, there's a question mark, and that's where we need to consider other factors when making that decision to deworm. The 5-point check, which might be a new concept to some of you, is an extension of the FAMACHA system. It's another decision-making tool. It's a decision-making tool for all the parasites that commonly affect small ruminants, not just the barber pole worm. I find it particularly useful when deciding whether or not to deworm an animal that has a FAMACHA score of 3. It would also be very useful where some of these other parasites are a problem, or at a time of the year when they're more of a problem. early in the spring, later in the fall, the barber pole worm is less of a problem. Some of those other worms become more significant. 5-point check involves 5 checkpoints on the body. The pictures show for each animal. The eye, we're looking at the Fibonacci score. The jaw, we're looking for bottle jaw. The back, we're looking at body condition score. The rear or the tail, we're looking for evidence of fecal soiling or diarrhea. The nose, we're looking for evidence of nasal bots, kind of a nasal discharge. Because that's not as common in goats, the 5th point for goats is to look at the condition of the hair coat. This is a pretty a slide with a lot of words on it, but shows what each of those checkpoints, what the observation part is, and then what the possible parasites that those measurements could be common to. Anemia, of course, being the barber pole worm, but it could also be coccidia, it could be liver flukes. Body condition score can be any number of parasites. The fecal scoring, or what we call DAG score, is primarily the parasites that cause diarrhea, coccidia being one of them, but also Telodorsasia and Trichostrongylis, which are cousins to the barber pole worm. The jaw, of course, is very similar to the eye, the blood-sucking parasites, the barber pole worm, coccidia, liver fluke. The nose is specific to nasal bots, a parasite that gets in the nasal passages, and the coat condition would be an indication of overall health, which could be a number of those parasites. But this just shows how the 5-point check can be a decision-making tool kind of for all of those parasites. Coccidiosis is the other big parasite problem, and just like the stomach worms, we want to look at it from both a management and a pharmaceutical approach, and also from a prevention and a treatment aspect. The best way to prevent coccidiosis, and it's a single-cell protozoa, and damages the lining of the small intestines. Primary symptom is diarrhea, but we also can see just very poor-doing animals, kind of rough hair coats. They're just not thriving. So the number one way to prevent problems is good sanitation. Dry, well-bedded barns, plenty of bedding, clean, well-rested pastures, clean feed and water, clean buckets, bottles, and teats, no overcrowding, not overgrazing. Predominantly a confinement problem, but we can duplicate that same situation very easily on pasture, particularly in an intensive grazing system, and particularly in areas that animals congregate. Good nutrition, animals that are doing well will be better able to handle coccidia, because just like stomach worms, it's normal for them to have them. They need to be exposed so that they can develop immunity, but they need to be exposed to low levels. Adequate colostrum intake will have a big effect. You know, it starts from day 0. Animals that get enough colostrum are able to fight things better. It's best not to mix different aged lambs and kids, and obviously anything you can do to minimize stress is going to help. We can prevent coccidiosis by using coccidiostats. We can put them in the water. It's a 3 to 5 day treatment. There's 2 choices, Corid and sulfa drugs. Both of those require a veterinary prescription. That's what that RX means. The TX means treatment. We can also put it in the feed or mineral. We need a minimum of a 30-day treatment. We have 3 different possibilities. Bovatec is approved for sheep. Rumensin is approved for goats, and both of them are approved for sheep. Decox is approved for both of them. Some things that are important to keep in mind about coccidiostats, and I'm a strong advocate that everyone should use them, is that intake can be variable and inconsistent. So while one animal might get a lot, another one might not get any, so the results can be inconsistent. They have little effect on an existing infection, so if a lamb or kid is clinically parasitized with coccidiosis, a coccidiostat's not going to do them a bit of good. They need to be given at least 30 days before the periods of risk. So 30 days before weaning, for example. You can feed them 30 days prepartum to our pregnant does and ewes to reduce the contamination in the lambing and kidding environment. They don't kill coccidia, they affect the reproduction and reduce the level that's in the environment. We don't want to use them year-round because they can become resistant, and in fact I think there's definitely resistance with Corid. The coccidiostats can be toxic, particularly Rumensin, if it's not mixed properly in the feed or the mineral. It's also definitely toxic to equines, rumensin in particular, but I don't believe I'd let them have access to Bovatec or Decox either. Rumensin's the one that's really the most potential toxicity for both the animals, or goats and horses, but you still want to be careful with horses. Prolonged or excessive use of cord can cause polio because cord works by affecting thiamine. The cases are rare, but it is possible. On the plus side, these coccidiostats have many, many benefits. They're approved for sheep and goats as coccidiostats, but in cattle, they're approved because they improve growth and feed efficiency, so that may be an added benefit. They help prevent free gas bloat. There's evidence that they may help prevent abortions caused by toxoplasmosis. Makes sense because that's a coccidia organism. So they have a lot of benefits. Once the animals get clinically parasitized, we need to treat them. We should treat them individually. We can't expect a sick animal to drink enough water or eat enough feed, particularly if those affected animals are young and they haven't been weaned and they're not consistently eating and drinking. We treat with oral medications of either Corid or sulfa medications. The sulfa medications are preferred, the picture there on the left, because they're more broad spectrum as an antibiotic and there's less resistance. I used to use Corid both on my farm and on a goat test, and we've completely switched over to the sulfa drugs. You can purchase these drugs over the counter, but they are not FDA approved for sheep and goats, so you need to have a veterinary prescription. You treat for 5 days. Your regular dewormers aren't going to have any effect on coccidia. Okay, this might relate to a few of the questions I've seen flashing in the chat box. We'll talk briefly about Sericea lespedeza, which is a forage that contains high levels of tannins. Think of it as a potential natural coccidiostat and dewormer. A lot of research has been done, particularly by my colleagues in the American Consortium for Small Ruminant Parasite Control, has been done in looking at how grazing or consuming hay or pellets made of Sericea lespedeza reduces parasite loads. There's a link where you can read a lot more about it. They have been shown to be effective at reducing parasite loads, so long as they're grazing there. Once they are removed from the Sericea lespedeza, then they go back to whatever the situation was before. A more recent study has looked at the effect of Sericea lespedeza leaf meal, which they make into pellets, to prevent and control coccidiosis. And that link there gives you a recent research article that was published where Sericea lespedeza was used in lambs. So only one provider of Sericea lespedeza, what's called the AU grazer, which is the variety that you want to use. They're the sole provider of seed and pellets. They probably do have distributors, but their name is Sims Brothers. So you can grow your own. It's only going to grow probably so far north. We tried to get a couple of stands in western Maryland, and we were unable to. When you're looking for condensed tannins farther north, we start thinking about things like bird's foot trefoil and chicory. They don't have as much condensed tannins, but they do have some, and they have some other things that might affect parasites. The other thing to keep in mind, just like nothing is ever a panacea, the research also shows that animals grazing Sericea lespedeza may not grow as fast as those grazing other forages, and here more recently they've shown where it may alter the mineral status of the animals. So it might help with parasites, but might hurt in some other ways, but could be a tool in your toolbox. Another what I would call natural method of controlling parasites, barber pole worm in this case, is copper oxide wire particles. They have been demonstrated to be effective against the barber pole worm. The researchers believe they have a direct effect on the worms, but also help boost the immune system. For a sheep producer, though, red flag needs to go up. Sheep are very susceptible to copper toxicity. Goats are more tolerant of excess copper and do have higher dietary requirements. So there are differences in the two species. The copper in the copper oxide wire particles is very poorly absorbed versus copper sulfate, which used to be a dewormer that killed a lot of sheep. and that absorption should reduce the risk. Keep in mind, copper nutrition is very complicated. There are different antagonists that affect copper availability and absorption, so it's not just a simple thing. There's a website there that'll give you more information about copper oxide wire particles. There's a product called CoperSure that's available to treat copper deficiency in cattle. They're large boluses. You repackage those boluses into smaller doses for sheep and goats into little gel caps, and then you administer them with a pilling or balling gun. We have tended to you tend to dose not by weight but by age. We did a study this year where we gave a half a gram to the kids and we gave a gram to the mature goats. In our buck test, we gave them a half a gram. We're probably going to go ahead and do that again next year, a half a gram. This is for parasite control. If you're interested in it for copper supplementation, you need to work with a nutritionist. Other natural coccidiostats and dewormers, there aren't really any, not yet. More research need to be done. So far, study after study has shown that natural dewormers are ineffective at reducing parasite loads. Whether we're talking diatomaceous earth, herbal dewormers, garlic, paprika, pumpkin seed, none of them have been shown to be effective. But I'll be the first to admit they always compare them to a dewormer. You know, do they treat the animal? Do they reduce fecal egg counts? Do they improve packed cell volume? Well, maybe they work by interfering with the parasite's life cycle on pasture. Maybe they improve the immune function in the animal. If they did either of those things, maybe they would simply reduce the number that need treated. So if you want to use a natural deworm, my only caution is keep looking at the animals, and when an animal needs deworm, go ahead and deworm it. But maybe some products or natural things, maybe they can help reduce the other number of animals that need treated. I apologize, I think I've been an hour already, and I'm just getting to hoof care. I'm sorry about that. I guess I thought I only had 3 topics and it wouldn't take very long. Hoof care, of course, is a very important aspect of sheep and goat management. Diseases associated with the hoof are probably, the most common next to parasites. How often you need to trim feet is dependent on many different factors, whether it's species, genetics, climate, environment, nutrition. It just depends. Some people trim feet every couple of months. Some people trim them every year or two. Some people never trim them. And the one thing I will caution is, on one hand, you need to make sure hooves are proper, not overgrown and not deformed, because they can be places where diseases can enter. But you also don't want to be overzealous about hoof trimming. The hoof doesn't need to be perfect. It needs to be reasonable. I've seen a couple of references in there to natural dewormers in the chat box. Again, I will repeat that diatomaceous earth is proven to be ineffective, as have a lot of these herbal dewormers. So keep that in mind. They have been proven in controlled studies to be ineffective. If they're effective on your farm, that's good, but if you want to find out if they really are effective, you need to split your animals into 2 and to see the differences between the different treatment groups. When should you trim hooves? You should trim hooves. You should trim them with the idea of minimizing handling and stress. Trim them in association with other practices. Don't trim feet too close to parturition. Don't trim animals right before the day of the show. And trim hooves when they're softer. If necessary, make them stand in a moist area for a couple hours before you trim them. The equipment that you need to trim feet: hoof shears, a hoof knife, a brush, and tight-fitting gloves. A lot of this has to do with how the condition of your animal's hooves and the numbers that you have to do, but to do a proper job you need each of these things. You need a method to restrain the animals. Now that could be what I call manual, almost no restraint. You tip the sheep on his rump, you put the sheep in a deck chair, you tie it to the gate, or you put the animal on a milking or trimming stand. You do it right there on the ground like they're doing with those goats. You can have assisted restraint using a tilt or squeeze table like you see there in the picture. It could be a half or full tilt. It could be a manual automatic. At our buck test, we have the goats on an elevated platform with their head locked, and that makes it a little bit easier as well. Some of it has to do with how many animals you have and how easy you want it to be. How to trim hooves. At the bottom, there's a good video on that goes how to trim hooves. That's kind of the best way to teach it, as opposed to me just trying to write down how you would trim it. You look at the hoof. You need to remove anything out of the hoof. You need to, basically your goal is to make that hoof parallel with that coronary band. You want that hoof, if you ever want to know what the hoof is supposed to look like, turn the hoof over of a baby lamb or a baby goat. You want to cut excess areas. When you get down to the soft tissue, you want to stop. You don't want to cut so much hoof that you cause them to bleed. You're going to need that hoof knife to really get the hoof cleaned out and to remove any pockets or get to areas that the shears can't. If you're doing routine hoof trimming, you don't have any disease problems, you can probably do most of it with a pair of hoof trimmers. But when you've got disease problems that you're dealing with, you really need that hoof knife to get in there. When you're done, you should spray the hooves with a zinc sulfate solution, and you should disinfect tools between animals. Other things that you can do to prevent hoof problems is foot bathing with a 10% solution of zinc sulfate, a foot soak pad that has zinc sulfate on it, the use of hydrated lime around heavy traffic areas, not putting animals in areas that are wet and heavily contaminated with manure, giving them access to hard surfaces that's going to help wear their hooves down. Research hasn't shown zinc supplementation to be effective, but on the other hand, a diet that's deficient in zinc could be problematic, and ultimately culling problem animals will help you prevent hoof problems. Finally, this is my last slide. Just briefly want to talk about nutrition, because nutrition and health are so intertwined, and you'll have a lot less problems when you have good nutrition. And again, it starts at colostrum with those babies. And then providing optimal nutrition. I say optimal because not everyone has the same goal for how fast they want their lambs and kids to gain on pasture or to gain on feed. So what's optimal for your farm? Feeding balanced rations. If you're serious about raising sheep and goats and all you do is toss feed into the feeders, there's really more to it than that. Animals have specific nutrient requirements, and you really ought to balance the rations to make sure you're meeting those requirements. Good mineral nutrition. You know, inadequate minerals can cause lots of problems or make animals more susceptible to certain diseases. I mentioned, I think in the last class, one of the best things you can do is if an animal dies or goes to slaughter is take its liver and kidneys and have a tissue analysis done to see what your mineral status is. You can never go wrong feeding good quality forages. We can get into a lot of trouble feeding bad quality. Bad quality forages are alright so long as we balance the ration with supplements, but good quality forages will take you a long way. Be willing to supplement during periods of inadequate or poor quality forage. You know, again, they have needs for balanced rations. Make sure they're getting what they need. If you're not willing to balance rations, at least use body condition scoring to determine the adequateness of your feeding program.